Here in our department view screen, you can see each patient is clearly displayed. You can see age and gender that are color-coded. And we have certain flags of things that might be interesting to you. For instance, contact precautions, whether or not this is a 72-hour return. And this is an icon that tells us who the patient belongs to as far as their primary care physician group. We also want you to know where you are as far as the task of charting. So in these cases, you can see the nursing documentation indicated with an N has been completed, whereas in this patient, no nursing documentation has been done. We also want to let you know where you are as far as order status, if orders have been ordered, if they're complete, and what the disposition of that patient is. In this case, this patient is being transferred. So again, these set of tools are provided to help you manage your entire department at once, because your job is more important than just taking care of one patient at a time. You have to manage the entire department. If you want to get into a specific patient, with one click you can see all of the data available on that patient. So we can see, for instance, vital signs that were recorded at intake. You can see who the primary care provider is, whether or not this is a 72-hour return. And in fact, if you want to get into those details, we can tell exactly when this patient was here and what their chief complaint was. This now becomes your cockpit where you're looking at the data related to this patient, and now you decide what is the next task that I want to do. I may want to start a chart on this patient. I may want to go complete the discharge documentation on this patient. So this becomes your cockpit for managing each individual patient. If we want to get into detail on the charting, we've tried to design our chart to be very intuitive, so there's minimal training associated with it. Once you open the chart, it walks you through the chart from the very beginning to the very end, reminding you of critical things that you might want to do. For instance, with procedure documentation, you might want to ensure that you document enough detail to be able to effectively capture the charges for that procedure. One of the ways that we have tried to make this charting experience be fast and efficient is to allow you to import and have high visualization on everything that has been documented at intake. So in this case, the vital signs are here, they're displayed for me. Past medical history, again, it's displayed for me. I can see that before I even start my charting. With one click, I can import all of that information. And now as I begin my charting, I can see the details that have been imported from the nurse's notes, and now I can start my documentation. For the rest of the documentation, what we try to do is we try to allow you to use a template where a template makes sense and where a template will actually speed you up. But at each case, we give you the opportunity to do free text charting so that you can capture the clinically rich, important story so that it functions as an effective tool to communicate what happened in your urgent care to their primary care provider or to the next provider who's taking care of them. We want to go back and forth between giving you a free text narrative and a simple template to make things fast. So for instance, if I want to say that this patient had a headache that began gradually 1 hour ago and that it's dull and that it happened at rest, again, with just a few simple clicks I can communicate that. And then I can use the free text narrative to tell anything else in the story that's important. For the review of systems, again, I've imported this from the intake note. It's very easy for me to say, to review this and to change this if I want to. I can say this patient did have some nausea, but no vomiting. That's very easy. And again, there's free text area here to say as much as you want. Past medical history, again, this has been imported from the nurse's notes. I can add more detail if I want to, or I can be satisfied with what's there. For the physical exam, again, we want you to be able to rapidly capture the physical exam so that you can populate your charge capture programming, but still let's make it fast. So for instance, if I want to say this patient had basically a normal physical exam, but now I want to really get into the detailed neurologic exam of this headache patient, I want to say exactly what was normal and what was abnormal. I can do that very, very quickly. And again, there's plenty of free text area here to be able to document any further details that I need, but most of the physical exam is templated and therefore fast. Any laboratory studies or radiology studies that you have can be imported, or you can document those separately. For the medical decision making, this is an area that we think is really, really important. So you need to be able to document the narrative. This is the part that most other people are going to be interested in, and we want you to be able to do that fast. We also want to provide you with cognitive reminders to be able to remember certain quality metrics, certain clinical decision rules that you might want to use for those patients, and those are here in the medical decision making. So for instance, if you had a syncope patient where you want to look at the syncope decision rule, we're going to put that rule in front of you. You shouldn't ask a busy urgent care physician to remember every rule all the time. We're going to give you the tools to be able to use those tools and those rules when you need them, but if you don't need them, then they become invisible to you. So here's your free text narrative. You can type or dictate in as much here as you need. But one of the other things that we find is that we tend to say some of the same things over and over again. So we allow you the tools to be able to manage those macros. An efficient, effective use of macros is one of the key things that make our chart one of the fastest ones on the market. For instance, if you are seeing a headache patient and you type out what you think is a very detailed and specific description of why you think this is a standard headache and isn't anything dangerous, then you can come down here and say save as, call that my low risk headache, and then the next time you come back to see a patient with a low risk headache, you've got it here. So you can say headache, low risk, you import that in its complete form, and now you can go back and edit those details or add additional details to this documentation. So again, effective use of macros to help you say the right thing, but to do it quickly. That's one of the key things that we think makes this the fastest chart around. And let's say we get down here to the clinical impression. Again, we want to come up with a codable diagnosis. So I can say this is a headache that's around the eyes. Again, this is going to get me an ICD-9 or ICD-10 code that helps say exactly what it is. If I want to analyze my charting to see how have I done as far as have I documented enough elements, with one click I can say, okay, I got enough history to get me to a level 5, enough exams to get to a level 5, and I have further details here. If there's some part of this that I didn't like, so for instance, let's say I wanted to get more review of systems, with one click I can go back up into the review of systems section, document a few more elements until I'm satisfied with it. And the nice thing about this is we take that combination of checkboxes and narrative diagnosis as well as decision rules to put it all together into a chart that comes out looking like a narrative. It looks like an old school dictation where anyone else who looks at this can figure out exactly what you were doing. So you've seen what our typical charting looks like if you were creating the chart from the very beginning to the very end. One of the things we understand about the urgent care world is that there tends to be a lot of repeat customers or repeat clinical scenarios. And nobody minds spending a few minutes to do a chart on a complicated chest pain or a complicated headache, but nobody wants to spend 2 minutes to document a typical ankle sprain. So we have tried to come up with tools to allow you to document simple, repetitive clinical scenarios very, very quickly. So that efficient and safe use of macros is really one of the key things that we think will help you be more efficient so you can spend more time with patients. So for instance, if I'm going to go see this ankle sprain and I walk out of the room and I know that this is a typical right ankle sprain, rather than starting a blank chart, I have previously saved a macro that tells me what a typical ankle sprain seems like. So if I start here, rather than choosing a blank chart, I want to choose a right ankle sprain chart. And again, this chart is customized to me. I saved it. It's very, very simple to use. And it says things like that are very typical for an ankle sprain. So the patient twisted their right ankle while they were, and I can type in here, playing basketball. And I know that ankle sprains tend to be sudden, they tend to be aching, they're severe, they get worse with palpation and with movement. Again, I've already filled those details out. There's still plenty of room for me to talk about the ways that this case is different from the typical ankle sprain, but all of the basic things are filled out. Review of systems is already filled out as if this is a typical ankle sprain. Past medical history, again, this is very specific to the patient, so I need to either fill this out or import this from the nurse's notes. For the physical exam, This has been saved as a typical right ankle sprain physical exam where it says the classic risk management things that you want to say for ankle sprains. But again, I can document this without typing. When I get down to the medical decision making, again, I have this filled out as if this is a basic ankle sprain, and I can choose whether or not this is a typical ankle sprain that required x-rays in this case, or a typical ankle sprain that didn't require x-rays. But again, that documentation is done by simple editing rather than creating from nothing. And I've already got the final diagnosis filled out as if this is a sprain of the right ankle, because it is. And then simply as just to start the chart, change a few things that are specific about this patient and save the chart. And so in our time studies, we think you can fill out a basic right ankle sprain chart once you've created the macro in about 14 to 15 seconds. That's the kind of thing that allows you more and more time to take care of patients. And then you can proceed to your discharge. In this case, I want to go into the discharge screen and discharge this patient. So again, we go from our patient view screen straight into the discharge section. I have recorded the diagnosis from the chart, so we don't have to repeat that. And now we can fill out the few fields that you need to fill out to effectively discharge the patient, including referral back to the PCP, which can happen automatically. One of the things that we want to do is be able to make it very simple for you to do common discharges with as few clicks as possible. So for instance, if you're discharging a patient with a headache or with back pain, you shouldn't have to walk through every phase of this discharge. You should be able to save a macro that now you can say, here's a headache patient. I want to discharge this patient with our standard headache precautions. So we've included a headache discharge sheet, specific instructions from the provider, and again, we did that with one simple click. That makes the discharge process fast, which means you can keep up with it, and so your patients aren't waiting. Now let's say I want to go from here to the charge capture form. Again, we understand the pressures facing a busy urgent care. You have to take care of all your patients. You have multiple patients at once, but you also have to be able to effectively charge, or else none of this matters. So here in the charge review form, what we try to do is pull out all of the relevant information from the chart so that you don't have to document it twice. We analyze that information, place it into the charge capture form so that with just a few simple answers, you can complete this charge capture form. We understand that there's a difference between a revisit or an initial visit, and we're going to code that directly. We pull the information from the HPI, review systems, and past family social history into here. Again, you don't have to answer those if you know you documented them correctly, but if you did want to change those, they're open for editing at this stage. One of the things that we do require you to do is make some comments on your medical decision making. Things like risk or the amount of data that you captured may not always be available from the chart, so we give you the chance to say that directly. So in this case, there's one diagnosis that's a new diagnosis. We didn't order any labs or x-rays. If you know that you got additional history from a PCP or you independently visualized an EKG or some other notes, you can add that data here. And then we ask you, what's the risk here? Is this a simple case, medium, or moderate? And again, you can decide exactly how you want to do this. So if you gave this patient prescription drug management, for example, that's easy to document here, and now you've completed your charge capture form. Any procedures that you've done, again, we're going to capture those charges. We're going to bundle those charges together. We want this to be simple for the physician so that you can completely finish your charge capture form with as few clicks as possible. And once you're finished with this, it's transmitted to your revenue cycle management software, and from a physician standpoint, you're finished.